AKRO. Tell me what you think of this one.
Yeah, this is a therapeutics company, John. This is an amazing thing. It's very near and dear to you and I because of our father, John Najarian, Dr. John Najarian. The guy was the most special guy in the world. And what did he do? He did kidney, pancreas, livers, islets, you name it, anything between the neck and obviously your waist. Our father was a big part of that, and he came up with immunosuppressant drugs that people all use. But this is a really interesting one, John, because of the fact that liver disease treatment. Now, this is a treatment, and the only other option is a liver transplant. Oh, so that's big deal, right? Well, if they've got a treatment that can do that, there's a good reason why this stock hit 52-week highs today, over $58 a share. This is only phase 2, so there's still some time out there. But when you look through the numbers that they were able to put up, absolutely incredible. It's one of those things where I think it is probably as big to me of a drug. Now, it's phase 2. We still got to get through phase 3. We've got to get through the whole process that you've got to go through to actually commercialize this whole thing. But this is a great start to that, John, and could be incredibly meaningful. And it's already a company that has a really nice balance sheet. So they are not in trouble. They have plenty of room for this to take a little bit of time to get it right. But I think this is one of the bigger news I think I've seen in biotech probably in years, to be honest with you. And I do mean that, multiple
100% move, folks. 102 if I give it all the credit it deserves.
Right.
And that's an amazing move. This is not a takeover, not yet, but this is instead just for, like Pete said, for you to do a liver transplant, Pete, it's hundreds of thousands of dollars. And if somebody had the option of not having to have a transplant and instead could have their liver treated, a lot less painful, and perhaps they could get them healthier before they do it. Because so often, as Pete knows, folks, because he was pre-med, an awful lot of people, when they go in for a kidney transplant, heart transplant, liver, and so forth, pancreas, they're pretty rough shape when they go in. So if you can get somebody healthy or healthier, let's say, prior to, because it's not a cure, but if you can get them healthier prior to a transplant, they're going to do a lot better. And that's why you got 100% move as much as anything, I think, Pete.